Alexander Lexajus, nagbabalik po tayo para sa update dito sa ECQ na nangyayari o mangyayari pa lang dyan sa Manila at sa apat na karatig na probinsya nito. Magsisimula po yan bukas hanggang Abril 4. Ang sabi dito, government to give aid to those unable to work during NCR plus ECQ. Yan po. Sino pa daw yung hindi makapagtrabaho sa panahon ng ECQ sa National Capital Region? May aid daw na ibibigay ang gobyerno. Sa mga detalye, narito po. The government will impose the strictest lockdown for 1 week beginning on Monday in Metro Manila, Bulacan, Rizal, Cavite, and Laguna, which have seen a sharp increase in the number of daily COVID-19 cases. So, ito daw ang pinaka-istriktong lockdown na mangyayari dyan sa Maynila, Bulacan, Rizal, Cavite, at saka sa Laguna. Dahil dito nakikita yung madaming numero ng coronavirus cases. Presidential spokesperson Harry Roque announced the drastic measure on Saturday as the Department of Health or DOH reported that the number of active cases had risen to more than 118,000 with new infection topping to 9,000 for the second straight day. The March 29 to April Fool enhanced community quarantine or ACQ for the national capital and the 4 adjacent provinces will be accompanied by a 6 p.m. to 5 a.m. curfew. Yun na nga. Under ECQ, people must stay at home. Ayan. Stricto po. Kailangan po. Stay lang po kayo sa bahay. With residents' movement limited only to accessing essential goods and services and for work in permitted offices and establishment. Kaya po pinibigyan ng isang permit lang kada pamilya. Yun po ang sabi. The government will distribute aid to those who are unable to work and the details are being finalized. Yun ang sabi ni Roque. Because the president understands that there will be no work while we are under ACQ, there will be aid given to our countrymen. Yun po ay dinagdag niya. Ang sabi dito, President Rodrigo Duterte approved the recommendation of the Interagency Task Force for the management of the emerging infectious diseases to place these areas under ACQ, which was based on the data on cases and healthcare utilization. Sabi ni Roque. So we want you to take drastic measures, or we want to take drastic measures because the rise in cases is drastic due to the new variants. Drastic threat warrants a drastic response. Yun ang sabi niya. It was the first time that significant parts of the country were placed under ECQ. So, mangyayari ay mag-i-impose po sila ng pinaka-istriktong lockdown sa bansa dito sa mga nasabing lugar. Ito po ay ang response nila sa pandemya. This means ang significant portion of the economy would be shut down in these areas and only essential businesses would be permitted. So, nakasabi na ang mga essential businesses, yan po yung pharmacies, groceries, hardwares, at isinalin na rin po itong restaurants na kung saan ay magkikater lang po sila ng takeaway at hindi po pwedeng magda-dine-in. Roque said the government expects the 1-week ECQ to help bring down the number of infections by more than 25%. So, kung mangyayari man yan, salamat po. At sana mag-cooperate po ang mga taong bayan dyan sa mga lugar na kung saan nakita nila ang pinakamaraming numero ng COVID cases. So, kung sinabing lockdown, dapat lockdown. Stay at home mga kapamilya. At kung may mga cases sa bahay ninyo, stay away from them. Give them the private or like a privacy, give them privacy And private room, that's the safest thing. Isi-self-quarantine nyo dapat ang sarili nyo pag meron kayong virus. Ang sabi pa, the lockdown was more strict than the modified ECQ proposed by the Octa research group, but shorter than the 2-week period it had recommended. So, isang linggong lockdown na stricto para dyan sa mga lugar na yan. At sana magtagumpay ang pamahalaan at ang taong bayan sa pagpigil ng spread ng nitong paglaganap nitong COVID virus dyan sa National Capital Region sa bansang Pilipinas. News tidbits tayo mga kapatid. Sabi ng DOT, Department of Tourism, bawal ang staycation within sa ECQ areas. So, walang staycation, walang hotel, wala mo nang wala mo na yan, yung 2 nights, overnight sa kung saan-saan, po pwedeng maging mitsa pa rin ng paglaki na nitong COVID cases sa bansa. Meron din tayong tidbits. Manila to issue 1 quarantine pass per family this week-long ECQ. So, isang tao lang ang pwedeng lumabas ng bahay kasi isa lang ang merong quarantine pass. Siya po yung bibili ng mga kakailanganin sa bahay. Papakita niya ito pagkadating niya sa mga boundaries or sa mga checkpoints. Tapos, kikip niya ito para pagbalik niya ay magagamit niya at mapapakita niya ito sa mga checkpoints. So, yan po ang pinaka-latest. Meron ditong Batangas lawmaker gets COVID-19 at ang pinaka-masaklap na nangyari, Zambales emergency health doctor dies from COVID-19. So, ito yung masakit na katotohanan na hindi mapigilan itong virus sa pagkitil ng mga buhay ng ating mga frontliners. Ayan. A government doctor in the front line of the fight against the coronavirus disease or COVID-19 in the province died on Saturday, authorities said. Dr. Jean Ribultan, 52, an emergency health physician at the President Ramon Magsaysay Memorial Hospital in the capital town of Iba, had tested positive for COVID-19 on March 25. So, ilang araw lang, 25, 26, 27. 2 days lang nung malamang positive siya ng COVID-19, namatay siya nung pagkasabado. So, PRMS is a designated COVID referral facility of the province of Zambales. According to the PRMS, Ribultan was the first medical frontliner in the province to succumb to the disease. She was also considered as one of the institutions of PRMMH, having worked there for more than 20 years, not only as an emergency room physician, but also as a former surgery resident. So, rest in peace po sa doktorang ito, kay Doktora Ribultan. And sana wala nang mamatay pang frontliner nang dahil dito sa COVID-19. And lang po for now, ang update tingkil dito sa ECQ dyan sa Maynila, sa Kamaynilaan at sa apat na karatig probinsya. Dyan sa National Capital Region. So, expect nyo kung sino mang walang trabaho sa isang linggong napaka-istriktong lockdown na yan sa NCR region, meron po kayong aid na matatanggap galing sa gobyerno. Meron dapat kayong isang quarantine pass at istrikto sila sa curfew. So, ibig sabihin, isa lang ang pwedeng lumabas at saka yung pwedeng lumabas ng tatrabaho na allowed ng gobyerno na pwedeng magtrabaho sa mga araw na yan ng ECQ. Good luck and sana makatulong ito sa pababa ng number ng cases ng COVID-19 dyan sa National Capital Region. Alexander likes the juice. Kung hindi mo pa na-subscribe ang aking channel, subscribe mo na. Drop your comment on my section down below. See each other there. At maraming salamat sa panonood. And yes, tap the button for the next update. See you on my next, guys. Take care. God bless Philippines.